can conclude from the one-year study of abatacept in psoriatic arthritis that abatacept is a useful alternative consideration in patients who have failed initial biologic treatment with anti-TNF therapy. The one-year safety profile looks encouraging. There's no particular problems that are occurring in the psoriatic arthritis patients that hadn't already been identified in previous rheumatoid arthritis clinical trials. So no additional worries. I guess for the practicing clinician, if you have a patient who's ongoing active joint inflammation, who has relatively a small amount of skin involvement, who has failed an anti-TNF therapy, abatacept should come into consideration in terms of what might be used in that patient next. I think for patients with severe skin involvement, the data would suggest that abatacept may not be particularly effective. The differences that were seen in the 6-month study between musculoskeletal and skin involvement were indeed seen again at the one-year study. So it does look like skin responses are not impressive with abatacept. That doesn't mean that have no response, but unfortunately it doesn't appear to be as effective for skin disease as it is for musculoskeletal disease. I guess from the company perspective, they'd be looking to see can they get a license to use abatacept in patients with psoriatic arthritis. So I suspect they're likely pushing for that at the moment. I guess from the clinician's point of view, we need a better way of being able to identify which patients are going to respond to which treatment. And I think that's the big challenge for those of us seeing a lot of psoriatic arthritis patients now, is that we have a range of treatments available, abatacept being perhaps the latest one to be added to that list. But we're not quite sure which patient should receive which treatment, and that's an area that I think we need to focus on. EULAR is a great but very large meeting with thousands and tens of thousands of abstract presentations. It's very difficult to see everything. You can't see everything, so you have to be selective. My focus would be in particular on spondyloarthropathy, so I'll be heading out now shortly to have a look at the poster session where all the spondyloarthropathy posters and abstracts are presented, so I look forward to that.